Recovery after a tummy tuck requires lots of attention. There's lots of things you need to remember and pay attention to when you're recovering from a tummy tuck. So let's kind of break it down step by step. So the first thing that I worry about after tummy tuck is I want to make sure that your skin stays alive. In order to keep your skin alive, it's important that your garments not be too tight. It's also important that you not lay flat or stand up straight for the first week. As part of a tummy tuck, as you know, I lift up the skin and fat layer on the front of your abdomen and pull it down tight, cut out the extra skin and sew you up. So that skin along your incision has been lifted up, which means lots of its blood vessels were cut, and pulled tight. Neither of those things are good for blood flow to the skin. So we need to do everything we can to keep blood flowing to that skin to keep it alive. Now you might say, well, why don't you make it looser? Well, I could make it a lot looser and leave it loose and fat. If I left the skin loose and fat, it would be much less likely to have a problem with blood flow, but you're also going to be mad at me because you paid for a tummy tuck and your skin is still loose and fat. So my goal is to make your skin as thin and tight as I safely can, and I won't push it too far because then I'm putting undue risk on you. But what I'm saying is it's a balance. So I'm gonna make it as thin and tight as I safely can. And then what I need you to do is to make sure that you're not around any nicotine, because that's gonna decrease blood flow to that skin and potentially kill it. I want you to not lay flat or stand up straight, because putting extra tension on that incision could potentially kill the skin. And lastly, I want to make sure your garments are not too tight, because that could also kill the skin. Once we get out about a week, things get a lot stronger. So after about a week, everything's looking good. You can start laying a little bit more flat. You can start standing up a little bit more straight. We can start making your garments a little tighter. We'll kind of take it day by day, depending on how things are looking. But initially, just do not put anything too tight on that skin. No, I don't want the garments too tight. I don't want you laying flat or standing up straight. By all means, do not be around any nicotine. All those things will hurt our fragile skin. Then the next thing to know about recovering from a tummy tuck is no heavy lifting. So no heavy lifting, that's what lasts the longest of the recovery. Is part of most tummy tucks is an abdominal wall plication, meaning I tighten up the loose muscles on the inside. Initially, all that tightening is only held together by sutures. Over time, your body will heal that like anything else, and it forms scar tissue inside, which is really strong, but it takes about 8 weeks for that scar tissue to become strong. So it's really important that you don't lift more than 20 pounds for 2 months, because during that initial healing phase, the sutures can only handle so much. And it's not a matter of the sutures not being strong enough. It's that if that repair and that tightening of your muscles is stressed too hard, too early, the sutures will just tear out of your tissue. So in order to prevent that from happening, I need you to not lift more than 20 pounds for those first 2 months. After that, your body will have healed enough that you can do pretty much whatever you want. You can do whatever you would have done before surgery. As for your skin, after about a week, you can start, like I said, standing up straight, laying flat, depending on how you feel and how tight the skin is. We'll start making the garments tighter with time, as long as everything looks okay. Most people are able to stand up straight and go back to work no problem after 2 weeks. The drains are generally out after 2 weeks. Some people go back to work after a week, but I would say you probably want to have a desk job or something physically easy if you're going to go back to work after a week, because you'll probably still have a drain and you're going to be wearing garments, of course. So I tell people, if you have a really easy job or you can work from home, a week's probably fine. If you have any other kind of job, you probably want to take 2 weeks off. If you have to lift a lot, like you work for UPS and there's no light duty and you have to be able to lift more than 20 pounds, you may need to take 2 months off. If there's no light duty or way you could go back to avoid lifting 20 pounds. Finally, the other thing to know after tummy tuck is that I need you to wear compression of some type for 2 months after surgery. So initially I'm gonna put you in a bodysuit and a binder, and then eventually the bodysuit's gonna be too loose, and that's a good time to switch to Spanx because they're more comfortable and easier for you to put on and off after you're about a week or two out from surgery. So then switch to Spanx or something like Spanx and put the binder on top of the Spanx. And obviously we'll guide you through all this during your visits, but I want you to wear compression for 2 months after surgery as well. So the 2-month things in a tummy tuck are you can't lift more than 20 pounds for 2 months, and you gotta wear compression for 2 months. Otherwise, showering, if all you had done was a tummy tuck, you can shower after 24 hours. Swimming and bathing, if all you had done was a tummy tuck, you can swim and bathe and go underwater after 3 weeks, assuming everything is healed up by then. That would be the 3-week mark. As far as exercise goes after an abdominoplasty, you can exercise, light exercise, cardio, that kind of stuff 1 week after the last drain comes out. So say that your last drain comes out 2 weeks after the abdominoplasty. That means you can exercise or do cardio 3 weeks after the abdominoplasty, but I need you wearing compression while you exercise, and you remember you can't lift more than 20 pounds for 2 months. So for that reason, cardio is okay, but you gotta wait until 1 week after your last drain comes out, and you have to wear compression. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.